Yo, let's talk health. But not just the eat your veggies, hit the gym kind of talk. We're going deeper. See, health ain't just about your body, it's about society too. Yeah, crazy, right? Your zip code can predict your lifespan. Your culture might influence how you view illness. It's all connected. Think about it. Ever ignored a cough because real men don't get sick? That's society whispering in your ear. We're taught to downplay pain, tough it out, but that can be dangerous. Ignoring symptoms delays treatment. It's like ignoring a leak in your roof. Eventually, things get messy. We need to acknowledge this societal influence on health. It's not just about biology. It's about understanding the context of people's lives. Where they live, what they believe, how much money they have, it all matters. Let's talk about stigma, that big fat elephant in the room when we talk about health. Some illnesses come with a side of shame thanks to societal perceptions. Mental health is a prime example. For years it's been brushed under the rug, considered taboo to discuss. This silence is deadly. People suffer in silence, afraid to seek help because they don't want to be labeled as crazy or weak. Families hide diagnoses, fearing judgment from their communities. This stigma prevents people from getting the help they desperately need. We need to break down these harmful stigmas. Talk about mental health openly and honestly. Encourage people to seek help without shame. Remember, it's okay not to be okay, and asking for help is a sign of strength, not weakness. Media. Oh, media. You giveth and you taketh away. When it comes to health, the media has a huge influence on how we perceive certain diseases. Think about it. Which ones get the most airtime? Which ones get the celebrity endorsements and the fundraising galas? Often, it's the sexy diseases, the ones with a face we recognize, a story we can get behind. This isn't inherently bad, but it creates disparities. Diseases that don't fit the narrative get lost in the shuffle, underfunded, and misunderstood. Social media plays a role too. GoFundMe campaigns for medical bills have become commonplace. While heartwarming, it highlights a broken system where healthcare access depends on going viral. We need to be mindful of the narratives we consume and amplify. Let's push for representation of all illnesses, not just the ones that make for good TV. Section 4. The unequal health divide, economics and education matter. Let's state the obvious. Your zip code shouldn't determine your health outcomes, but sadly, it often does. Economic and educational disparities create a massive chasm in healthcare access and health literacy. People living in poverty often lack access to basic healthcare, healthy food options, and even safe places to exercise. Low health literacy can lead to poor health choices and delayed diagnoses. This isn't about personal failings. It's about systemic inequalities that need to be addressed. We need to invest in underserved communities, provide access to affordable healthcare, and promote health education. Everyone deserves a fair shot at a healthy life, regardless of their background or bank account. Section 5. Building a better system. Why social context is key. Here's the bottom line. Healthcare isn't a one-size-fits-all system. We need to move beyond just treating symptoms and start addressing the social determinants of health. This means acknowledging the role of cultural stigma, media representation, and socio-economic disparities in shaping health outcomes. It means creating healthcare systems that are inclusive, empathetic, and tailored to the unique needs of diverse communities. It's time to stop treating healthcare like a luxury and start treating it like a human right. Let's build a world where everyone has the opportunity to live their healthiest lives, regardless of who they are or where they come from. Peace out.
Lighten up, take me